Good morning, my name's Jared Alexander. Here's my name here, Jared Alexander. Today's date is 9th January 2021, and it's currently after midnight. This is my assistant who I will be doing the surface anatomy presentation with, and her name is Sabrina. Okay, so we're going to go over the 5 important structures. Here are my notes, so I don't forget anything. So first thing I'll go with is the around the McBurney's point on the anterior crest of the iliac spine. So right here, so anterior crest of the iliac spine, there's this McBurney's triangle, and right in this area here is the appendix, and also the cecum ileocecal valve, and the start of the ascending colon. It's clinically significant for appendicitis attacks and appendectomies. That's where the inflammation would be. That's where the test would, for rebound tenderness would be applied. And systems involved is the GI system, the gastrointestinal system, and also the GU system, genital urinary tract system, because also the ureter passes around this place, and also if a kidney stone gets caught in there, urolithiasis would also be present in that area. And also the cardiovascular system, because the iliac artery starts running right and down in here, and then becomes femoral artery as well as it progresses through the groin and inguinal region. Next would be the suprasternal notch, which is right here, and this is where it starts. We have the clavicle joint. The clavicles, they articulate right here at this joint. Right directly below it would be the first intercostal space with the first rib. And then we have the second rib, and then we have directly the angle of Lewis. Now this is significant for needle thoracentesis sites. You come down on this, right down here, between the second and third intercostal spaces, and for doing needle Ds for pneumothorax decompressions. Also, there are sites for auscultating the cardiovascular and also the lungs. So we have the auscultation sites right there between the second and third ribs, on both the left and the right side of the maneuvering body, right there. So the systems involved are the cardiovascular and the respiratory system, and also directly above or right behind that supraclavicular notch is also the thyroid gland, which is part of the endocrine system and the immune system as well. It releases T cells. I believe my last, only the thyroid. The thymus releases the T cells, which is not part of this anatomy. And next would be the mastoid process, so I'll turn you right here. That's right directly behind the ear here, and there's empty cells here, air-filled spaces with the cells here. This is clinically significant because if they get infected, then the infection could quickly spread to the brain, the central nervous system, or also into the ear chamber as well. And those are palpated during a physical examination, check for tenderness to the mastoid process. And they are not part of any body system specifically. And then further behind is the, I marked them right here, L3 and L4. And then directly below is L5, where it articulates with the S1 vertebrae. And these are significant for lumbar puncture sites for drawing up cerebrospinal fluid. And I'll have my patient face anteriorly, and directly here we have the umbilicus here. This is clinically significant for as the right left to the midline of the umbilicus runs the abdominal aorta. So if there's a dissection or a aneurysm of the abdominal aorta, this is where auscultation we would listen for bruits, anything of that nature, or any tearing, feeling for any pain or pulsations from the aorta. Now, this is also cardiovascular system and the GI system that are involved. Other organs in this area, we have the ileum, and then further to the left would be the descending colon. And those were and also some other clinical significance. Not only was the aortic aneurysm, but also small bowel obstructions. When auscultating, we'd be hearing some high-pitched tinkling sounds or whirring sounds as well in this area here. Thank you. That's all I have.